My name's Amanda White, and I'm a forensic psychologist and clinical neuropsychologist. I've been working in the area for over 10 years in the forensic field, and my particular area of interest is combining my skill sets to work in the subspecialty of forensic neuropsychology. I work with clients across the lifespan. I have a particular interest in working with older persons. I've been working part-time at a hospital in the area of aged care and rehabilitation medicine for that time, and I find that really enjoyable. Working with that particular group, helping them to identify changes that may have occurred and what that means for them, whether it be from a clinical perspective and indeed a legal questions. So my role primarily in the medical legal context is to provide comprehensive psychological evaluations. And what that involves is looking at an individual's cognitive, psychological, and social functioning. And the way that we do that is to look at, use a range of techniques, which might include clinical interview, psychometric testing, as well as review of collateral information, and sometimes working with other specialties as well, to provide a comprehensive view and understanding of that person's behaviour and how that might impact them, whether it be at a day-to-day level or in relation to a specific question, such as capacity, for example, or indeed in the medical legal context, a legal issue. And then following on from that, the assessment is provided in a report form, but it also may involve talking with the relevant parties to communicate in a meaningful way the results of the assessment to inform not only the legal question, but it also might relate to treatment and management issues. I became interested in my specialty. I've always had an interest for forensics, and when I started out as a psychologist and particularly doing assessment work, I felt that I really needed to be providing a comprehensive and robust evaluation. And so I actually went back and studied to do neuropsychology to enable me to evaluate brain functioning as well as psychological functioning, and to combine the two in my assessment work. I really enjoy how that intersects with the legal context, and I really enjoy medical legal work because of the challenge and the diversity of the work that we do in this field. And finally, I think what's important to me is feeling that I've been able to assist in the process and to impart information that's relevant, admissible, but also meaningful. Across my career, I've seen a wide range of presentations. A lot of the individuals that I see have suffered some sort of brain injury. Often that may be a result of a traumatic process, such as a motor vehicle accident. These individuals commonly present with some psychological concerns as well. And so it's evaluating both the cognitive and psychological components. Across the age span, I'm also very well versed in seeing in older persons presentations where there are queries about neurodegenerative processes. My work has entailed working with a variety of different groups of individuals from different backgrounds, whether that be cultural or social backgrounds. Often individuals that I see have had issues with substance abuse, so the presentations are really wide-ranging and varied. That's one of the joys about working in the medical legal field, is being able to see a large cross-section of individuals and those from a range of industries and backgrounds. So I've been fortunate enough to work with a range of people from whether it be from health backgrounds to aviation to your tradies on the job, to office administrators, to those studying still at university. So a wide range of industries, and that's one of the things that really keeps me on my toes, is being across different job descriptions, what people do for work, how that might interplay with their behaviour and cognitive functioning. A really important skill, I think, is being able to communicate clearly concisely, but also in a way that matches the target audience. So I really strive to work on my communication skills, whether that be in an oral format or written in the report, to be able to communicate with the client as well as the claimant, of course, but to discuss the case if necessary, to work with them and alongside them from the first point of contact right through to the end, to making sure that the report hits the mark, that I've answered the questions that are required, and that I've communicated that information in a meaningful way. I also really try and work in a collaborative way. So taking a collaborative approach is really important to be able to provide a holistic and robust assessment, and to be able to, I think, provide that really high quality assessment that we're looking for in this context. Finally, I think working to ensure that I identify any core issues, not just those that might come in a letter of instruction, but looking beyond that to make sure that the report is providing as much information and context as possible to be able to aid the resolution of claims as quickly and promptly as possible, and to make sure that it's meaningful for the claimant as well. When an injured person comes for an assessment, it can be very daunting. Often they can present as somewhat nervous, which is completely understandable. And some of the things that I want them to know when they come to see me as an expert is that they're going to be respected. They're going to be heard. So I'm going to take the time to listen to what's going on for them, what symptoms they may be experiencing, and how that is impacting them, whether that be at a day-to-day level or in a particular context. And finally, that they have that assurance that they're seeing a qualified and highly skilled expert who's going to meet them with the level of professionalism that they expect. I really hope to achieve the goal of being able to provide high quality assessments that highlight the relevance and the important role that forensic neuropsychology can play in this space. And ultimately, the goal is to enable the relevant parties to achieve the best outcomes, whether that be helping a judge to make a very important decision by providing them with relevant and validated and admissible information, whether it be to provide an insurer with an answer as to what might be going on for the claimant, and just making sure that I do so in the most professional way possible, using the highest quality expert skills that I possess.